Hey you all, welcome back to StabilityWOD. I have a ton of new stuff to share this week after my slow-mo video of where you can see my foot mechanics during heel strike and during mid-foot strike. And I have a bunch of other slow motion footage that I want to share that is a sort of more functional, helpful way to strengthen your feet and to gain awareness around how your feet operate during impact. However, the first step for a lot of people is getting these muscles activated back online. I mentioned a few days ago that there are some stirrup muscles that are in your lower leg, in your shin, around the inside, outside, and even in the back of your lower leg that act to stabilize your arch. They're like the orthotic muscles of your foot. And they work with the muscles in the bottom of your foot, the arch of your foot, to help to control your foot and ankle position during all kinds of activities. I had a client not too long ago who was a really great example of someone who lost function in those muscles. She was hiking downhill, and every 5 or 10 minutes she had to stop because her ankle was starting to sublux. It was starting to dislocate. She'd have to stop, sit down, work with her foot to get it reset again, and then she had about 5 or 10 more minutes before the muscles fatigued, shut down, and she felt unstable again. Within 2 weeks of doing this very basic progression of activation exercises, she was totally fine to hike again. And we took her super unstable joint and we brought the sort of called force closure. That's the muscle's job of keeping the joint held together. We improved that force closure so that her ankle felt stable again for most of her activities. So this progression I like to call boring but important because it's super old school, super boring, but it always amazes me how effective it is for people when they've had old ankle sprains, if they have Achilles tendon problems, if they have tendonitis around their ankle, foot pain. When people have a history of recurrent ankle sprains or ankle fractures, this is just like a magic bullet. So I can't stress enough, this is super simple, super old school, but very effective.
The first thing I'm going to do is take this long band. It doesn't have to be this long, but it has to be relatively thick so it's challenging to your ankle. I'm going to hook it around something relatively strong. Piece of furniture works if you don't have a squat rig handy. I'm going to loop it around the ball of my foot, and I'm going to scoot away so I have enough tension on there where after 10 or 15 reps of pulling up and down, I start to get pretty tired. Now I'm looking for a couple things here. The first thing is that I'm looking to slowly release tension. If you find that it's really jerky at first, it's because the muscle doesn't have great control over the movement. So you want to try to go slowly enough that you can smooth that movement out. You're also trying to get as much range of motion as you can up and down. After 10 or 15 reps, I have enough tension on there that I've worn out my anterior tib, which is my shin muscle, where a lot of us get shin splints. It's also one of the arch support muscles, so it's important to have that strong. Next, I'm going to turn to the outside. Now the band wants to pull me in. I'm going to anchor my lower leg with the other leg, and I'm going to be now pulling out on the band. And you can see I'm a little jerky on the way back in, so I'm going to work to smooth that out as the muscle comes back online. Working to wear out now the peroneal muscles, which are the muscles that we overstretch when we sprain our ankle. So these muscles out here, they have a major support role in the lateral part of the ankle, and they work with the arch support muscles in order to keep our ankle stable. So I'm going to get through as big a range of movement as I can. After 10 or 15, I'm pretty worn out. Flip to the other side. Now the band wants to pull me outward and anchor my leg, and now I'm pulling inward. Slow control on the way back out, working on smoothing it out as I make it tired. And this is the posterior tibialis muscle. When people have shin splints on the inside of their lower leg, this is usually the muscle that's involved. This muscle works with anterior tib to control the arch and to support the ankle and foot. So again, after 10 or 15 reps, I'm going to wear that guy out. And then I'm going to switch legs, assuming I need to do both ankles, which is usually recommended. I'll do the same thing on the other side, and then I might repeat the same progression on the right leg again, maybe 2 to 3 sets total per leg. When I get done and I stand up, my ankles will tend to feel a little more stiff, a little more stable, and definitely more tired.
Now you guys, I literally tell people that they can do this for a week or two until they get the muscles back online. Then they're ready to progress to harder, more functional integration of these muscles into their sport. I think one of the most interesting things about activating the muscles around the lower leg and foot and restabilizing the ankle is that it has such a profound impact on injuries that show up in the lower leg, sort of from the knee down. So calf strains, Achilles tendon problems, peroneal and posterior tibialis tendonitis, shin splints, recurrent ankle sprains, of course, metatarsal problem, Morton's neuromas, even bunion stuff. Some of these activation strategies are such great starting points. They're such simple, elegant solutions to at least start to lay the groundwork for these types of injuries to be able to heal. Just because the ankle and foot are maintained in so much healthier a position. So as much as I like to call these old school and maybe they're a little boring to do, they're super important, and I encourage you to give them a try and see how quickly you get tired, especially if you're suffering from one of those types of injuries, or if you've had recurrent ankle sprains. You're one of those people that says, oh, I roll my ankle every time I'm on the trail. It doesn't even swell or bruise anymore. I just whack it and then I'm fine. Maybe it hurts for a day, but I just do it like every time I'm out on the trail. If you're one of those people, I think this is a great example of an exercise that can not only keep you from doing that so that you don't keep overstretching, tearing at your ligaments and connective tissue over time, but it will also, in the long term, help you prevent things like arthritis and other joint injuries that are the result of hypermobility or instability where the joint is too loose. So this is working on force closure, getting these muscles to better stabilize your ankle. I look forward to hearing your feedback. Please take a second to subscribe. As always, please share with your friends, and I look forward to seeing you tomorrow.